So with that, then let's move to the program part. And today, Tom, you don't get to introduce one person, you get to introduce two people, not only Faye, but also Hazel and her speaking engagement. So here you go.
Thank you. Yes, sir. It's my honor to introduce to you today Hazel Reinhardt. Hazel is she lives here in Edina, but her passion truly is in Tanzania. Hazel is president and CEO of the Foundation for Cancer Care in Tanzania. She takes her job very seriously. She brings a lot of passion to it, and she's going to tell us about it here today. And before she did this, she was actually a faculty member at the University of Wisconsin-Madison, and she was the state of Minnesota's first demographer. So please welcome Hazel.
Thank you very much. Welcome, Mayor. Someday I'll come and talk to you about Edina, okay? I have a lot of information about Edina as well. Well, thank you very much. It's my pleasure to be here. And yes, I am passionate about Tanzania. I've been involved in projects in Tanzania for nearly 20 years. Initially, I focused on education, and now more recently on healthcare. And I've taken a passion for cancer care in Tanzania, in part because my late husband died of cancer, and I clearly understand the implications of that disease, especially in a very resource-poor environment. So cancer, I mean, I think all of you think about malaria, you think about communicable diseases, but cancer is emerging as an epidemic in sub-Saharan Africa. And it's becoming a major crisis in many ways because, believe it or not, the population is aging. And there is a correlation between aging and the incidence of cancer. Now, one thing I've learned in talking to Americans is that we're a little geographically challenged. So I find it's important to show where Tanzania is located. It's in East Africa. It's the largest country both in population and land area. It has a population of about 59 million people. At the time of independence, it had about 15 million people, so it's had explosive growth. The UN and the like are suggesting it could reach 100 million. That's kind of mind-boggling. It is bordered on the north by Kenya, Uganda, Rwanda, and then on the south by Malawi and Mozambique. Life expectancy about 65 years of age. And access to health care is a very major problem. Now, African countries, sub-Saharan African countries, with somewhat the exception of South Africa, have many, many challenges, economic development being a big one, education, health care. But today we want to talk about health care. Now, Tanzania is among the 10 poorest countries in the world. A lot of people live on the $1.25 a day or less. And in this very poor country, there are approximately 35,000 new cancer cases every year. And there's limited, virtually no prevention education, very little in diagnostic work, screening, and the like. And hence, a cancer diagnosis, if it is even given, is essentially a death sentence. That over 80% of the people who have a diagnosis will die. So, and most often it's even not diagnosed. There's a saying in Africa that if you don't have a fever, you're not sick, because they're so accustomed to communicable diseases with fevers. It's various projections. I've taken a conservative one here that about 70% increase in the number of cases in the next couple decades. The American Cancer Society says it'll be over 100% increase. And one of the big issues is treatment abandonment. That is, you have a diagnosis, you've been prescribed a treatment plan, you may go for one treatment, two, and then you abandon treatment. And that is a result of basically 4 factors. One is cost. Second one is distance from the facility, transportation, or absence of any housing. And if you are, and you go there and visit, you will find people sleeping on the lawns. They have no place to go, waiting for treatment or in between treatment. Now, in 2013, the Foundation for Cancer Care started organizing. It's sort of an offshoot of an organization called the East African Medical Assistance Foundation, which was founded in honor of Dr. Helmuth Diefenthal, who was a radiologist at the University of Minnesota and a missionary, medical missionary in Tanzania. And so it was incorporated as a 501c3 in 2014 with the idea of increasing access to cancer care. Today, our cancer care center at Kilimanjaro Christian Medical Center, KCMC as it's called in Moshi, is only the third cancer care center in a country with 59 million people. So you can see that many, many people have no access at all to cancer care. And of course, we were committed to improving the quality of life. And I would describe us as a catalyst. We are basically a very small 501c3, but because we came into existence and started a program and started building, we needed to build infrastructure. We were able then to generate foundation support from some large pharmaceuticals. So if you look at our budget today, it looks very healthy, but most of it comes from money that came from large foundations. And we're really committed to the 4 pillars of cancer care, total comprehensive cancer care, and that is education, prevention, screening, diagnosis, treatment, and then palliative care. And fortunately, Tanzania does allow morphine. Some sub-Saharan African countries do not. So we are able to have very robust palliative care. And many people, of course, present themselves when they're in stage 3 or 4 of cancer. So really it is palliative care that's critical. Now, we're very fortunate to be able to partner with KCMC. It's a very large hospital by sub-Saharan African standards. It's located in the foothills of Mount Kilimanjaro. It was founded in 1971 by the Good Samaritan Foundation. It took them about a year to get it, not a year, 10 years before they got any buildings. And if you're familiar with the history of Tanzania, it started out as a socialist country, and the government has a tendency to want to nationalize things. When anything gets too successful, they want to nationalize it. Then they nationalize it, and then they find they can't operate it or run it, so then they give it back. So this hospital was started as a private hospital. It was nationalized by the government. Then the government, after 5-7 years, decided that no, they couldn't manage this. So then they gave it back. But the deal was that it is now a government hospital in the sense of paying the salaries of everyone, but the government does not build anything. So that is left to private parties. It's a major referral hospital. It's called a zonal hospital, 15 million people, lots of patients. They have beds for 630. Some days there are 800 patients. As you can see, almost 1,900 students. There's a medical school, a pharmacy school, a nursing school. Staff of 1,300, about 1,000 people a day visiting. It's just swarms of people. If you're there, it's just unbelievable. And for African standards, it's kind of world class. Okay? Now, what we started out with was basically nothing in cancer care. And so we had to start to build infrastructure. So we built an outpatient clinic, and you'll notice this all has the British spelling. And then an outpatient infusion center, and those both opened in December of 2016. And then we launched palliative care and preventive services screening in 2017. Those are continuing. Now in phase 2, We're just waiting for the groundbreaking for an inpatient cancer ward with 44 beds, and we're working on this family care hostel that will have 24 beds. And then phase 3 will be a radiation center, and that is scheduled sometime 2020 and beyond. And that, the government says, it will add some money to. You can see by the numbers, the need was there in the first year and a half, over 8,000 consultations, over 1,200 new patients, 786 patients received chemotherapy infusions. And what you see here is a rendering of the family care hostel. This has been through sort of a torturous process. We had once thought that we would be eligible for a global grant from Rotary, so we had container constructions, refurbishing containers, and the foundation said, no, that doesn't cut it, so now we're back to a local project and more traditional construction. And some more views of it. Now, why the family care hostel? Well, as I mentioned, people fail to complete treatment. And for those reasons that I've mentioned before, we view them as barriers to care. But I think the great tragedy is children, because most childhood cancers are curable if treatment is followed. And we have here research studies that show more than 40% of children who start treatment abandon treatment. And they abandon it because cost may be one thing, but the big issue is transportation and housing. And where a hostel has been provided, we can reduce the research shows that we can reduce the abandonment of treatment to about 8%. So that's the compelling reason for the hostel. And this is a case of an example of a family. This man, who's a farmer outside of Singita, which is quite distant from Moshi. His little girl was diagnosed with a retinoblastoma. He realized, of course, there was something wrong, and he heard about the cancer center probably through his church. And the trip, 250 miles by bus. And let me tell you, that's a journey. It's a very real journey. And he brought the child and was committed to treatment. The transportation costs ate up his whole annual salary of profit from his farm. Now, fortunately, we have a fund to pay for transportation, and there is a foundation that will pay for the chemotherapy. So we were able to provide him with assistance. But this is the kind of person, kind of case that the hostel is designed to provide: a place to stay, a safe place, a place to have food, take care of people and the like. So we believe that developing this really promises to improve outcomes. We believe it can be a model for other areas of the region. We've been seeking Rotary funding to develop this facility, and pediatric patients will be given priority in it. As I mentioned, it's a 24-bed hostel. When you deal with many people who have diseases in a very advanced stage, you really do think about hope and healing, that what you're about is hope, not simply a cure. And the big thing is the housing has a bathroom and shower facilities, and there will be a playground. We already have the equipment waiting to be assembled. Then I want to show you a little video in here.
When we look at the progress, it is absolutely remarkable. With all this success, it's time to start thinking about what's next. Now, there's two open issues that we have right now. The first is that many of these patients are coming from 6 or 8 hours away to receive treatment. So we need to build a hostel here so that these families have a safe place to stay while their family members are receiving treatment.
Most of the patients may come and don't have where to stay. Some of them may be disabled and may need not admission but because they need to come frequently for the chemotherapy, they cannot meet the financial means to actually make it every 3 weeks for chemotherapy. So we've observed that some of the patients actually struggle to finish their chemotherapy as a result.
The second problem that we have is many of these cancer treatment plans call for radiation therapy. Radiation therapy is not widely available in Tanzania. The two closest centers that provide radiation therapy services are about 10 hours away. And the standards that they're using there are standards that would have been found in the U.S. back in the 1950s and 60s. So our goal is to bring modern radiation treatment here to Moshi, Tanzania.
As we know, most of our patients are economically and financially, they struggle. And so sending them to Ocean at that time, it's they tell them to go home and and hope for the best. But most of them will not go and they will not make it because of financial constraints.
You can estimate that we will have like 50 to 60% of our patients need radiation to get cured. This will be a huge step to reduce the mortality of the people.
Some of the successes that we've had, but some of the challenges that we are facing, and hopefully going forward, we can slowly address them as the center expands. So thank you to the people who have actually done this wonderful job and have actually contributed, be it their time and money to make this happen. And we can assure you that things are happening and will continue happening. And we will make sure that we will do our best, for the patients' interest. Yeah.
I believe that a small contribution can make a major change here.
So to all donors and FCCT, big thank you for what you've done so far and for all your efforts and for all your donations you've done. Without you, it wouldn't be possible to treat all the patients. Thank you very much. Thank you very much, Sandra.
Thank you, Asante Sana.
We need you and to make this happen and to make this happen. Well, there's an African saying which says one finger cannot break a stick. So we need several fingers to actually break a stick. So together we can break the stick, yeah? And so together we can break the cancer, together we can fight cancer. Thank you.
Well, where are we today? The estimate is on the design that you saw the rendering about $180,000 for the building. We have Rotary support. Our club in Marangu is going to be the lead club. We have 4 clubs in Moshi that are interested. We have received $6,000 from a German club. Germans are very eager. They've already transferred the money when they make a decision. That's it. No fooling around. We have a $10,000 pledge from a Florida Rotarian and his club, the gift to be determined. I think probably $5,000-6,000 with they're going for a district match. We're going to have a GoFundMe campaign here in the U.S. We're approaching several other German clubs, and you might be curious about the German clubs, but remember that Tanzania, in its days before the World War I, was Tanganyika, and it was a German German colony, and their relationship with Germany is actually quite close. A lot of German expats there and the like. The doctor you saw, Dr. Oliver Heinke, is a German from Berlin. So we're looking for support from Rotary clubs in the United States. This is, I think, a unique opportunity to provide hope and healing. It can be a one-shot deal. It can be a multi-year commitment, because there are, once you get into this, let me tell you, it's just one thing and another thing and another thing as you increase the services you provide. So we hope to have this open by 2021. The club in Marangu has as one of its members the man who holds the world record for climbing Mount Kilimanjaro in speed. He's a Tanzanian, unbelievable, I think about 7 feet tall. And he just races up and down that mountain. We're committed. We believe that hope and dignity are not commodities reserved for the global elite. And so we've made great progress. We have a good relationship with the University of Minnesota, which is a leading cancer center in the United States. We have, 4 or 5 faculty members of the University of Minnesota on our board, and very active. So I want to thank you for listening to me. I would welcome support for this project, and hope, if nothing else, that you've learned a little bit about what's going on many, many thousand miles away. Thank you very much. Pardon. Oh, and I do want to say that our major fundraiser is a gala, which is October 26th this year. And I'd be happy to answer any questions, but I know time is fleeting.
We have a few minutes.
Okay.
There's a couple of questions. We have a few minutes.
Yes.
Is there a reason for the high cancer rate there? Did they find anything like drinking water or, some of the other things?
No. The issue, cancer for women, the leading cancer is cervical cancer, and that has a correlation with the HIV virus. So that is the leading cancer for women, and then followed by breast cancer. For children, this retinoblastoma is, we think there's evidence that that's more common in this area of Tanzania than elsewhere. But there's a cancer registry. There are great opportunities for research. So those things are underway. If you go northwest to the hospital at Buganda in Mwanza, Lake Victoria, their cancer care rate is fairly high as well, and that's related to mining, they believe. But this doesn't seem to be environmental per se. Yes?
So in Guatemala, we were at a national pediatric hospital, and literally it serves the entire nation. This is the same type of concept where people are coming from all over the state to...
They're coming, Tanzania has 6 health zones, called, and so a zonal hospital is the hospital. If you were in that zone or you saw a doctor in that zone, they would refer you to that hospital or that clinic. Today, the 2 places with radiation are at Ocean Road, which is in Dar es Salaam, the capital, or up at Buganda. The trip is almost impossible for a woman with cervical cancer because of all the bleeding. You just are not going to make it on a bus. But I mean, 59 million people. Yeah. So, and then of course, many people, you're still dealing with people going to traditional healers. The other thing that I find interesting, I showed you the case of a farmer, a man who took action, but most of the advocates are women, and they're usually the grandmother or it might be a mother, but the grandmother is usually the one who becomes convinced that something has to be done and that she will seek and take the child around for her, looking for an answer. Yes.
Tim Burke, 15 years ago now. It's a beautiful country, wonderful people. How did you get interested in Tanzania?
Well, I got interested in Tanzania through my church. As I tell people, I'm a Lutheran. The German missionaries were there long ago, so there's quite a substantial Lutheran presence in Tanzania. So I became interested in the education of Maasai women, girls, about 20 years ago through my church. And then I visited, and then I really got hooked. And it's one of the great, you may think of Kenya for a safari. Go to Tanzania. It's spectacular. And then I was involved with an organization called Operation Bootstrap Africa. I was the president of the board there, and I was on the board for, I don't know, about 15 years. And then I won't call this an opportunity. I say that I was sort of the last man standing when I was asked to be president of Foundation for Cancer Care, because as you can, I don't have a healthcare background, and I've thought of that as a disadvantage for a year or two, and now I no longer see it as a disadvantage. I'm beginning to have a pretty clear view of what we should be doing. So I thank you very, very much.